Hey, what's up, everybody? Dr. Ryan Weaver here with Apex Spinal Performance Wellness Workshop. Today's going to be part 2 of arthritis. We did part 1 last week, so do us a favor, jump on over to YouTube, Facebook, subscribe to us, like us on there. That way you can stay up to date with everything that we post on our wellness workshops, along with a lot of other content. So again, the reason we do these workshops is continually to educate our patients, our community, because we know for a fact, the more educated we are, the healthier decisions that we make. So, arthritis. And I'm going to jump right into this content, right from where we left off, talking about the differences of osteoarthritis and aging. So, that being said, arthritis in general, there are different types. Primarily today, we're going to be talking about osteoarthritis. So, from the 2008 study that I referenced on last week's workshop, study of competitors in the Senior Olympics age 50 to 75, age 50 to 85 from the American Journal of Sports Medicine found that the decline in sports performance didn't really happen until age 75. So, if we use that as a benchmark, 75, we've got a long way to go before then. And some of the things we're going to talk about today are going to be how we can prevent these things happening. And we really need to look at that, depending however old we are. Obviously, starting and implementing changes is the first thing we got to do. We have to do that, whether that's working out, eating healthy. Now, if you started that at a young age, then we're more capable, if you will, as we get older to continue to enjoy life, be functioning, and do the things that we love to do, and not be such, hunched over, poor posture, poor range of motion, bound to wheelchairs, and not enjoying life as we should. So, many studies have compared the differences between osteoarthritic patients and the aging population. So some of the things that we notice with osteoarthritis: inflammation. We can see remodeling of all tissues around the joint, articular and periarticular osteophytes, with other changes on x-rays. Aging, the first one, no inflammation. Cartilage changes only. Osteophytes only with excessive use. So you're going to see the contrast difference between aging and osteoarthritis. Now, treatments for arthritis. A lot of these are common that we hear of. Over-the-counter drugs such as aspirin, ibuprofens, hyaluronic acid, surgeries, joint replacements, right? That just happens all the time. Bone fusions, arthroscopy, so where they clean out cartilage. Exercise. With exercise, we try to think of less high impact, more water aerobics, recumbent bikes, walking. Other things, acupuncture, chiropractic care, supplements such as glucosamine and chondroitin. You see these things a lot for treatments of arthritis. Now, we're going to dive into some of these. And again, my goal is always to try to avoid surgeries and injections as much as we can and other prescription drugs. So, things to know about over-the-counter drugs. And we're going to stick primarily with NSAIDs. So you get into your aspirin, Advils, Motrins, things like that. We know that the therapeutic dose for this is 2 to 4 grams daily. This is pretty high. The toxicity that can happen, you see symptoms and side effects like gastric irritation, tinnitus, fluid retention, kidney and liver damage, bleeding easily, bruising easily, a lot of these other side effects, and you've probably heard of the majority of those. Another side effect not often mentioned is the inhibition of cartilage repair, an acceleration of cartilage destruction. This came from the Journal of Rheumatology. So the other part with NSAIDs that we got to watch for is having been associated with acceleration of osteoarthritis and increased joint destruction. So long-term chronic use, toxicity, we're going to see it speed things up and destruct the cartilage faster. So prevention. Again, I referenced this earlier. The earlier that we address these things, the better. But there was a study done with 400 elderly people living in India, and they found evidence of weakness in their quadriceps muscles preceded the advent of osteoarthritis. So we're going to be talking primarily about the knee for this example. The stronger the muscles, the greater the load that they could take off the joint, thus limiting damage to the cartilage. Again, this shouldn't shock us that the stronger we are and more muscle we are, within reason, the healthier we are. We move easier. We have less damage to the joints. Among older adults with knee osteoarthritis, engaging in moderate physical activity 3 times a week can reduce the risk of arthritis-related disability by 47%. That's from the Archives of Internal Medicine. So, prevention, another question I get asked a lot. Actually, yesterday and last week, I got this question. Is being overweight cause this to be worse? Well, overweight or obesity isn't necessarily a causative factor, but if degeneration is present, it can amplify or accelerate this as well. Other things to look at: your activity, your occupation. Not too long ago, we talked about desk job ergonomics, right? A standing desk. 75% of our country sits for a living. And we're typically in the position where we're hunched over and our head's forward. So these are little things that you can change. Overactivity performed incorrectly. That can lead to inappropriate loading of the joint, which inevitably, again, leads to arthritis. So, all that being said, what does our body do with arthritis? How does this, again, happen? We know if we have misalignments or we have pains and we try to get away from them, our body compensates, which is just going to continue to cascade and make this whole process worse. So, a word that we talk about often in our office is subluxations. So, subluxation, via an alteration in the microenvironment of, we're going to get real technical here for a minute, chondrocyte and vertebral kinesiopathology, will cause spinal osteoarthritic degeneration. Kinesiopathology, excuse me. The correction of subluxation can only attenuate and arrest this degenerative process, but actually allow the condition to reverse itself. So this was from Dr. Russell, disc regeneration. So basically what we're saying there is a subluxation, a misalignment, it's going to irritate from a cellular level, causing degeneration. If it's corrected, the subluxation that is, we can slow down degeneration and at some point possibly reverse it. So again, good news. So we talked about what are things that we can do. We as chiropractors help continue to help maintain the joints so that the body can function as best as it can. When we have that compensation, whether that's from pain, genetics, whatever that may be, these are things that we want to try and prevent. So back to the aging portion of this. Shockingly enough, this statement I'm about to go over here, degenerative joint disease affects many people under the age of 20. Research proves that 10% incidence of identifiable radiographic osteoarthritis, so found on an x-ray, in a random group of age 15 to 24, actual degenerative changes could occur noted earlier than that, just not seen on an x-ray. So, what we know. We know the triggers of osteoarthritis. We know that our function and structure play a role in this. Without having healthy moving joints, we cannot avoid degeneration. So if we can control our environment, and environmental factors, we're talking about traumas, falls, accidents, the poor posture that I just gave you an example of, sleeping with our cervical spine or our neck being really raised or in a weird condition or a weird position. So without using a pillow in general or a neck cervical pillow to help reinstate the natural curve. But always we have to think about the things that we invest in. Again, a topic I just had a conversation of. Without our health, we have nothing. We have to pay for gym memberships. We have to think of the healthy things that we eat in the grocery store. And just so happens the healthier things are usually the more expensive things. we have to invest in our health because over time, we're going to need it more and more and more. So we need to address this and take action now. A few things I wanted to compare, as I just referenced exercise, I just referenced eating healthy, and obviously being adjusted, being a chiropractor. These are things that I preach about. And we have vital needs, and as much as we think about nutrition and exercise, those are very important. Okay, when we look at exercise, obviously talking about muscles, talking about our heart and our lungs and everything there as well. So I want to put, if we had a pyramid here, in terms of things that we have to have, and 4 of the top things that I always discuss are food, we need water, we need our nervous system, and we need oxygen. If we had to put those in a hierarchy, we can go days without food, roughly 40 to 50 days probably. What about water? Well, about 3 days or so, we have to have water. And then we talk about oxygen. Well, I think the world record, I actually just heard this weekend, I think it was 14 minutes. Somebody could hold their breath. So we know that these are things that we have to have, right? They're vital need. We got to breathe, we got to have water, we got to have food. And the last one we talk about, and again, obviously the most important, is our nervous system. Without a nervous impulse, we can't function. We literally can't move a muscle. We don't work. We don't function. And just so happens, our brain and spinal cord are totally encapsulated in bone. So yes, osteoarthritis can happen in shoulders, any joint for that matter, but obviously I'm referencing the spine, that if we have that pressure up against our spinal cord, our nervous system, a lot of bad things can happen, not just from a pain standpoint. So I ask you that we have your spine checked, wherever you may be, have your spine checked. You don't have to have pain to go to the chiropractor. I got that question actually last night. Somebody asked, well, do you have to have a symptom or have to have pain to get checked? The answer is no. Again, we approach this here at our office of how can we be preventative, how can we be proactive? Majority of people, yes, they do come in with some symptom, but we want to try to thrive, not just survive. So I hope you found some of this interesting. I tried not to spread this over at part 3 of arthritis, but as we always evolve our workshops, we probably can expand this into a 3-part series. But I hope you found some information knowledgeable on here. It was a lot spread over from causes to prevention to things to watch out for and try to avoid. So we'll look forward to seeing you in our next workshop. Y'all take care. We'll see you then. Everybody, hope you enjoyed that spinal workshop. Don't forget to like the video and feel free to share it if you learned something. Be sure to subscribe to our channel so you have quick access to our videos, and also don't forget to hit that notification bell so you are alerted every time that we post a video. You can also check out other spinal workshops by clicking right over here. Until next time, make sure you live your best life, and we'll look forward to seeing you at that workshop.